I never thought the moment changed how I practiced orthopedic surgery would happen standing at my kitchen sink on Christmas Day. Not in the operating room, not in a board meeting, not during a contract negotiation. It happened because my sink backed up, and the plumber who came to my house used to be a doctor. That conversation forced me to confront something I had been avoiding for years. In medicine, if you take insurance, you never determine your own value. And eventually, that reality either breaks you or forces you to redesign the way you practice. I think a lot of surgeons already know this. They just haven't said it out loud yet. I'm Dr. Tyler Goldberg. A few years ago, I realized traditional orthopedic model was slowly commoditizing orthopedic surgeons. So, I stepped off the hamster wheel and I built a different practice model, one that allowed me to stay in insurance, serve my patients, and finally regain the leverage over my time, my relationships, and my value. Now, I help other surgeons do the same through NAOCA. For most of my career, I did exactly what the system asked me to do. High volume, high production, clinic 2 days a week, surgery 2.5 days a week. I was productive, I was efficient, I was relentless, and I believed the deal. Work hard now, sacrifice now, and the rewards will come later. That's what we're taught in medicine, right? Delay gratification. Miss the holidays, miss weekends, miss your 20s. And honestly, if you're like me, you missed your 30s too. And for a while, I believed it was worth it. But something strange started happening. My surgical volume kept going up year over year, but yet my value kept going down. The same hip replacement I did 15 years ago, I get paid less today for. Doesn't matter that my outcomes are better. Doesn't matter that my technique is better or my efficiency is better. Doesn't matter that my judgment is better. Mastery doesn't matter. The system doesn't reward craftsmanship, it rewards throughput. And I started realizing something that honestly scared me. No matter how good I became, I never got to determine my own value. The insurance companies did. Medicare did. Negotiations I never sat in did. Not me. Then, on Christmas Day, it happened. Our sink backed up. Water everywhere. Dinner was cooking. The family's all in the house gathered around. And somehow, we found a plumber willing to come out on Christmas Day. I'm talking to him while he's working, and he just casually says, well, just like medicine, plumbing knows no weekends or holidays. I froze, because that's our phrase. That's what we say when we're on call. That's what we say so we can justify ourselves when we miss Christmas, or we miss New Year's, or we miss a family event. So I looked at him and I said, how did you know that line? And he looked straight at me and he says, you know what? Because I used to be a family practice doctor. And then he told me something I'll never forget. He said, I realized I could make more money as a plumber than I could as a physician. And for the first time in my career, I got to charge what I believed my services were worth. And then he looked at me and said, guess what? Today, I'm charging you $375 to fix your sink, and that's what you're going to pay me. Because that's how plumbing works. And standing there in the kitchen, I sat there and I realized that's not how medicine works at all. Now, at that point, a lot of people would say, just opt out of insurance. But I couldn't do that. The patients who trusted me early in my career, the people who helped build my skill set, I didn't want to abandon them. I didn't want medicine to become inaccessible. I felt trapped. Stay in insurance and stay commoditized. Or opt out completely and leave people that you care about behind. And honestly, that resentment started building. Then I realized something. Maybe the problem wasn't medicine itself. Maybe the problem was believing that volume was the only lever left. I didn't want to stop operating. I love surgery. I love doing joint replacement. I love helping patients. What I hated was the hamster wheel. The feeling that every year I had to run faster just to stay in the same place. So I started building a different model, not fully cash pay, not fully opted out, a model that let me stay in insurance while giving patients the option of a more personalized experience. And then one day, something happened that changed everything for me. I was out of town and my medical assistant texted me. A patient had come in from out of town and she signed up for the concierge program without me ever being there. My assistant closed the patient. That's when it hit me. This wasn't just selling something. This is something that patients actually want. The model worked. The value was real. And maybe, just maybe, there was another path forwards for surgeons besides pure volume. I think there are a lot of surgeons right now quietly asking themselves the same question I was asking. Can I really do this for another 10 or even 15 years? Not because they don't love surgery, because they're exhausted from being commoditized. Volume goes up, value goes down, and the treadmill begins. And eventually, it's going to break people. NAOCA exists because I believe surgeons deserve another option. Not abandoning medicine, not abandoning your patients. Redesigning the model so great surgeons can finally practice on their terms again. If you're a surgeon who knows the system isn't working anymore, you're not crazy. You just need a different model. And that's what we talk about here at NAOCA.